More than 1,000 complaints that had gone through to SAHPRA regarding reactions to vaccines. Just take us through what sort of complaints have come through and how you're dealing with them.
Thank you, Desiree, for having us as SAHPRA. The South African Health Product Regulatory Authority, SAHPRA, as you are aware, that our responsibilities are to protect the human health and through making the products that are available to the public that are safe and effective and of good quality. And indeed, these complaints are being received by the regulator. As you are aware, that is the responsibility of the regulator to investigate all the adverse events following immunizations or following vaccinations. And as a result of that, we have received all these complaints, and indeed the regulator is doing its responsibilities in terms of investigating to see if there are any safety concerns that could be looked at. And this is our responsibility, and we continue to do so as that resides within our mandate, Desiree.
Do you feel like, as you speak of that responsibility of assuring South Africans of the safety and efficacy of these vaccines, do you feel like SAHPRA has fallen short in some way as we daily get reports of South Africans, a growing number of hesitancy and what has now been called anti-vaxxers? Why is it that South Africans are not feeling assured of the ability of the vaccines to help them in the fight against COVID-19?
Thank you, Desiree. And indeed, I think you yourself, and together with the South African population, you should have confidence in the South African Health Product Regulatory Authority, because in terms of the legislative mandate, we wouldn't make available any product that is not of good quality and that is not safe or effective. And indeed, all the products that we've made available for administrations into the public or the populations are products that we have confident on them in terms of safety and efficacy. And we can assure the public that the products that are available currently, that have been made available, are of good quality and they are safe and effective for continuous use. But as the regulator will continue to monitor any other adverse events. And this is our legislative mandate, and we will not fail the public in terms of safety and efficacy of the products that have been made available to the public for consumption.
Yesterday, we got reports that Nigeria, the country had approved Sinovac. How far is SAHPRA in terms of approval of other vaccines, including Sinovac and Sputnik, or Moderna, for argument's sake?
Okay. Thank you, Desiree. And indeed, as you made reference to the Sinovac vaccines, it has gone through the entire process of regulations and review within SAHPRA. And as you are aware, that we have authorized the use of that product in the country. But like we indicated before, that for each product, we've got other specific conditions that will attach to each authorization. And as Sinovac has been made available, because SAHPRA was confident that this product should be available, and we've attached a specific condition to that product. And also if I also respond to the issue of the Sputnik, the Sputnik V applications has also been received by the regulator, and we have done all the due diligence in terms of the review. And there are also other issues that we are resolving between the regulator and the manufacturer. And this is to assure that when we make products available, we are confident that the product that we are making available to the public are of safe and of good quality, and they are effective. And this is the issues that we go through as we scrutinize all the products to comply with the current legislative requirements.
We were talking earlier about those complaints that have come through that you're dealing with at the moment, but part of that is the report of 29 deaths that SAHPRA has come out to say it has conclusively determined that it was not linked to those people vaccinating. Take us through this process and how you were able to make these determinations.
Thank you, Desiree. There's an intense investigation that goes through finding out these adverse events as they are reported. in terms of determinations of whether the causes and the casualties was as a result of the vaccinations. As you're also aware that an individual will react differently to vaccinations. And as we have our own med safety applications, and this is the responsibility that lies with the manufacturer for them to also assist the regulator in terms of investigation. So what we do is we also investigate the batches, individual batches that were vaccinated or the individuals was immunized with. So we go to an extent where we also consult all the healthcare professionals, including the physicians that were involved during the vaccinations. So this is the process that the regulator, together with the manufacturers, go through for them to conclude on the outcome of the investigation.
Just take us back. You were saying earlier that there are certain conditionalities that are still outstanding in terms of full approval of Sinovac. What are they, and how is this delaying the process?
Although I might not necessarily dwell on the specific conditions that we've attached to the product or that applications, but as you are aware that the regulator, as we approved and make available the products, we also have some additional information that we'll be requiring from the manufacturer. And an example that one will give now is that if we have received the data that confirm the stability of the product to be of 6 months, there's a continuous studies that we expect that the manufacturer conduct, and when the results are available, that's when we expect that the manufacturer will share that additional information with the regulator to proceed and grant, if we're granting the 12-month shelf life of the product. So those are some of the issues that we'll engage with the specific manufacturer regarding the application that they would have submitted to the regulator.
And just finally, how is SAHPRA engaging with the conversation of vaccine hesitancy? What kind of awareness programs are you running? I think through the office of the CEO, there is a continuous engagement so that all the SAHPRA employees and the communications officers are available to interact and to answer all the specific questions that are related to how we do our work, so that we can assure the public that the products that are available, that they're being administered to the people of these beautiful countries of ours, are products that the SAHPRA is confident of the safety and efficacy of that product. And therefore, that's we encourage people to proceed and vaccinate as the only way we could have the protections against the COVID-19 infections. Khamusi Mutoti is the manager for biologicals at the South African Health Products Regulatory Authority. And we were talking about the conversation that's taking place here at the SABC throughout the day.